Once again, good morning to everyone who I didn't get an opportunity to say good morning to personally. And this is our first webinar of 2019 and my very first webinar with SHIP. I'm flying semi-solo today, but we're going to go over our 2019 updates for Parts A and B, as well as we're going to look at what Part D enrollments look like for the year, and we're going to go over our annual enrollment review for 2018. Each of you should have gotten the presentation, and we're just going to follow that PowerPoint verbatim. Okay. Now, for our Part A premiums for 2019, the quarters for 30 through 39, we see an increase of $8. For those people who are 30 quarters and below, we see an increase of $15. For the Medicare Part A deductible, there is a $14 increase for 2019. Are there any questions? So when we look at the Medicare Part D costs for a hospital stay during the benefit period, we see for days 1 through 60 that there has been a $24 increase. For days 61 through 90, we see a $6 increase. And for days 91 through 150, we see a $12 increase. When we look at the skilled nursing facility benefit period for a Part A cost, there has been no increase for for days 1 through 20, but when we see days 21 through 100, we see a $17 increase. Are there any questions when it comes to our Part A Medicare costs for a hospital or skilled nursing stay?
Vivian, we did have a question come into the chat box. Is this cost per month?
Okay. So is that for Part A or was that for Part B?
I believe that's for all the numbers that you've been talking about.
Okay. So when we look at the Part A premium cost, then that cost would be per month. However, when we're looking at the Part A hospital stay cost, and I guess I'll go back. When we look at it's broken down per day. So when you look at the 160 days, if you're in the hospital 160 days, then that's the cost per day, that $1,364 for the days 1 through 60. So if there's a break and you go home and you stay home 2 days, 3 days, and those days start over again. So that's the cost per day. Okay. So someone's having a problem with some sound signal?
Yeah, I'm talking to them individually. So some people, if you aren't able to hear the sound, which most people are going to be able to hear the sound if they're hearing me talk, it could be because they're trying to listen through a computer. And sometimes the sound doesn't work, so they just have to call in. And I believe Peggy Ransom has her hand raised, so I'm going to unmute your line, Peggy, so you can ask your question.
Sydney, I didn't have a question.
Oh, okay. So sorry. There is a question that says, isn't the $1,364 Part A deductible per benefit period?
Yes.
Oh, and there's our lovely hold music that we tell people not to put us on. Found them. Vivian, you may want to go into depth about what a benefit period is, or I can help you out if you need to as well.
Yes, thank you.
So a benefit period that we're talking about with the slide that's currently up, a benefit period starts the day that you're admitted as an inpatient into the hospital or a skilled nursing facility and ends 60 consecutive days after you've been discharged. So for example, I go in the hospital January 1st, I'm treated and released January 15th. My 60-day benefit period, or my 60 days that I have to be out of the hospital or skilled nursing facility, starts on January 15th. That's when the first 60 days, that's when you pay your deductible. So that's the benefit period. You have to be out of the hospital within 60 days after being discharged. We also had a question come in, will the slides be available to print as well, either before or during the webinar? Vivian sent out an email to everyone who registered for the webinar with the PowerPoint and other information attached, so you should be able to print them off there. So, sorry, Vivian, back to you. Those were, I believe, all of the questions that have come in so far.
Okay. Now we're on to our Part B Medicare costs. For your 2019 Medicare deductibles, the Part B premium is $135.50, which is up $1.50. The Part B deductible is now $185, which is an increase of $2. When we look at our Part D Medicare IRMA cost, the income-related monthly adjustment amount, you can see there is now a new category. From looking at your slide, there's an income amount of $500,000 to $750,000, which we hadn't seen in previous years. So that is new based on the income tax returns that were done in 2017. So there are some people out there, enough people that Medicare CMS saw fit to add this income category for us to know that the premium for persons who file individual tax returns of $500,000 or for couples who file a joint return of $750,000, their Medicare Part B Medicare premium will be $460.50. Are there any questions related to the IRMA premiums?
Nothing's come into the chat box, Vivian.
Okay. So we'll go to our Medicare Part C and D. Medicare Part D deductible for 2019 is $415. For 2019, your donut hole starts at $3,820, and it will end at $7,653.75. For most of us, we know that the donut hole is a combination, or the donut hole is a combination of when you and your plan have reached the cost, or you get into the donut hole when you and your plan have reached the cost of $3,820 for 2019, and you exit the donut hole at $7,363.75, and you go into catastrophic after you have come out of the $7,653.75. At that point, when you reach catastrophic, you'll pay you'll pay the lowest copayment for your drugs at 5%, or $3.40 for generics and $6.50 for brand names, whichever is greater. But during the donut hole, you'll be paying 25% for brand names and 37% for generics. There's also a chart attached that will help you or any beneficiaries that you're talking with understand the donut hole a little better. Are there any questions?
Nothing's come into the chat box, Vivian.
Well, once again, these are the numbers with the donut hole in reference to the cost for the generics have gone up by 5 cents and 15 cents for brand names. And we know that people who receive extra help don't go into the donut hole for sure. And we'll go over the extra help and Medicare savings plan income resources and guidelines in March on the March webinar. And yes,
Vivian, we did have a question come in. Oh, sorry.
And yes, the donut hole is for both the expense that you and the drug company incur, but it does not include your Medicare premium, your Medicare Part D premium. And once again, when we look at our income-related monthly adjustment amounts, the IRMA for Part D, we see that the individual amount for a person who files taxes individually is the cost of that person's Part D premium. However, when we look at or even with jointly, the $1,070 is the monthly premium. But when we get to the person who is an individual filing taxes who has $500,000 or above, or a couple filing jointly $7,550.
It doesn't download as a PDF file. It's a TTT file.
Was that a question?
No, that was a side conversation. I muted that line.
Okay. So we see that CMS, they have added additional income for those persons who individually have filed taxes stating that they earned or received $500,000 as an individual, or as a couple, $750,000. So their Part D premium would be $77.40 plus the monthly plans premium. And so that is something new that we haven't seen before, but we have quite a few people who must have made $500,000 or above as an individual, or $750,000 as a couple. Now, Sydney may have to answer some of these questions if you have anything in reference to this, but the Medicare Part D enrollment outcome history, as many of you know, Tennessee started tracking in the pilot program. In 2017, Tennessee was among 10 states to participate in this pilot program, and they provided additional data to demonstrate and describe the direct services that were conducted by the SHIPs in the 10 states. The goal was to accurately demonstrate the work conducted, and it was not about high dollar outcomes. We were able to track the before and after costs for many Medicare beneficiaries that we enrolled into Medicare Part D drug plans and or Medicare Advantage plans, and it has been so successful that all data is still being compiled even now, and we are entering that data into the new database STARS. The data was not only collected during open enrollment, but it continues to be collected year-round. And the Part D enrollment outcomes are now collected nationwide based on the pilot program that Tennessee was a part of in 2017. It was so effective that it is now collected in all 54 shifts. Sydney, would you like to add anything about this?
Just a thank you to all of the volunteers and staff who have reported that data. Without you guys, we wouldn't have the results that we had. A little bit more kind of on the history side, the reason why the pilot came to be is many of you will remember back in 2017 we did have a funding crisis to where we were at risk of losing funding for the SHIP program nationwide due to one of either the Senate or the House voting to not fund our program. So one of the ways that ACL, our funder, the Administration for Community Living, wanted to show our true impact is to record those numbers, because that's what a lot of our elected officials like to see, is how we're impacting the community based on numbers. And Vivian's about to show you some of our numbers here shortly of our impact across the state. So thank you all again for who's participated, and if you haven't started participating, get with your regional volunteer coordinator or with Vivian, and we can walk you through how to participate in that program.
So, as a part of the outcomes, there has been $11,333,375, and we're still counting. Due to SHIP Talk going down and STARS not being able to run reports at this time, we have not been able to get numbers from June up until the end of open enrollment. But as of today, there has been that $11,333,375 million that we have saved our beneficiaries here in Tennessee. And once again, we are internally grateful for everything you do to make this possible to help the Medicare recipients here in Tennessee. We are greatly appreciative of everything that you all do. Now, to talk about the annual enrollment, what was good, what was better, and what was best. If you have anything you'd like to say, Sydney is going to be able to monitor these questions, comments, concerns. This is a time to speak.
So also you'll see an image in the middle of your screen. It says Jane Doe, parentheses me, with your hand raised and a red circle around it. So for those of you, since we muted a lot of people, we've had a lot of background noise this webinar. If you have a story of either good, better, or best, please highlight your name in the participant list, and you'll see a hand sign, and then you just click the hand, and I'll show that your hand was raised and that you want to talk. And then when you're done speaking, you can unclick the hand, and then I know you don't have a story to share. Or, like we mentioned, feel free to type your comments or your stories into the chat box, and we can read those to everyone on the webinar.
Well, I'd just like to say that I had the opportunity to visit, I'm still learning regions, so forgive me. It's the Southeast, where Helen is, and Christian McWhorter, if I'm not mistaken. I had an opportunity to visit them during annual enrollment and just coming from ACMS and only being able to see how we did things in West Tennessee and to see them do things differently. It was enjoyable. It was great to see the way other people do things and see them get things accomplished, and it worked well for them. So seeing something different that worked just effectively and efficiently and to meet some of their wonderful volunteers and their Medicare beneficiaries. I had an awesome time. I learned a lot about how things flow differently, and just one way is not always the right way. So I thank them for having me.
Vivian, if you want to advance your slide 1, I think we're talking just about the good stuff right now, the good news stories. We had one come in that says we had more diversity in terms of location and income.
Okay, great, great. Any additional comments? Okay. Is there anything that we could have done better?
Oh, well, we did have a couple more good stories come in, sorry. So one said our agency went to some of the same places we have went in the past, and our number of individuals increased. There is now more calls that are coming in that stated individuals are looking forward to annual enrollment.
Great, great, great.
And another one said, I had a couple of participants. I was able to locate prescription drug plan resource programs for a couple of expensive medications. So going outside of just the plan finder, looking for those patient assistance programs.
Wonderful, wonderful. Always good to save money. Always. Are there any additional comments? If you're not able to chat, just raise your hand and Sydney can unmute you, or
I do see that John's hand is raised. I'm not sure if that was from earlier or from current. So John, I'm going to unmute your line so you can make your comment if you have one.
John?
That might have been from earlier. He's the only one who has a hand raised.
Okay. Now, so is there anything that we could have done better during this year's annual enrollment period? All right.
We had a comment come in that one of our volunteers was able to cut her own personal prescription costs down by 2/3, or by 66% for 2019. So that's amazing.
Definitely.
Really shows that importance of comparing your plan every year.
Yes.
I know personally one thing I could have done better during open enrollment, granted I'm transitioning out, but I could have done better on my follow-ups to clients who I helped in the past, to make sure, just send them little reminders, send them a worksheet. I used to keep a list and I lost my list, but I could have done better personally, people that I've talked to in the past, following up with them.
Okay. And I see that getting the mail-outs done earlier, or keying in the mail-out sooner, yes. And I think that goes with maybe designating a volunteer to take that role on. Maybe discussing that with one of your stronger volunteers who may have that extra time, who may not feel so comfortable counseling or something of that nature, to do that. That may be something I would look into doing, is somewhere in August, maybe after the children have started back school, getting them to spearhead doing that mail or keying those in and getting those ready within somewhere in that mid to late August and getting those ready, to go out. I would definitely look at pulling a volunteer to spearhead that. That is something that a volunteer could definitely do.
Tina, I see your question, and we are going to address that question after the recording has stopped, just to remind us. And Adrienne Franklin, you have your hand raised. So you have the floor.
Hi. Yeah, a couple of things that could have gone better for us. One of them was, I mentioned that we had more diversity, which was good as far as our location from the previous year, which was not diverse in the slightest. But now, I'm sorry?
That was feedback. We're going to try to mute that person.
Oh, okay, sorry. But one thing, even though we did try several new locations, some of them panned out, some of them didn't. So one thing we can do is try to just maybe hit some of those locations earlier in the year to make them more aware of the program, so that if we do come again later that year, they're expecting us and know what we're doing. Some locations that we did twice, based on the traffic, we might want to cut down to just once. I still want to hit that area, but maybe not use as many resources in that way. Another thing that we could have done better, and this is kind of, I think, because as some of you know, we've had a lot of transition issues here, and that led to we didn't always have people who could come, or who were willing, I should say, to come in and maybe help out in the office, so that some of us could maybe go to more locations. So we often had to leave. Someone who would have liked to have gone out more had to stay here, was kind of housebound a lot. So just getting a bit more of that office help. We had some good help going out in the field. And then the other thing that I would say we could do better, and this again had more to do with our transition issues, is just to make sure that, and we could probably get some advice from you guys on this, that we educate in-house, so that they know what we're doing and don't do things that are counter to us doing what we're supposed to do.
Of course, and I think, and we're working on that. We're working on that. I believe that we've even gotten an email asking for education in that area, so we're working on that. And I see that definitely going, oftentimes when you first go into a location, it may be difficult to get the amount of attendance for a first time or going back after a few years. But I think during the year, when you drum up interest in the community by going to places that the people in that zip code or the people in that neighborhood attend, whether it's sending information to the churches or to the neighborhood watch meetings or whatever, when you frequent them during the year or send information to those, then I think you'll get more response during an annual enrollment event.
Yeah, I agree. Now, I did want to mention there was one place that we actually did hit a few times, and so I think sometimes it may actually be also a matter of educating the directors there, because this person, the place we went to, we had been there twice within 2 months before, and they were supposedly all excited. We get there, not only is the director not there, the assistant director who had been in contact with wasn't there. Most of the people didn't even know we were supposed to be there, except for one who had vaguely heard about it and didn't know which room we were supposed to be in. That was a heck of a day right there. So getting set up when people are looking at us like, and y'all are who again? And it's like, it's on the schedule, which we brought y'all the 2 times we were here before, and nobody still heard of us. And that's because the 2 people in charge just decided, hey, we're on vacation, so deuces. So an education maybe with some of the directors as well of these centers. Of course.
And sometimes going by a day or 2 before or on your way in, or sending, maybe a volunteer in the area to make sure that there's signage up a day or 2 before the event may help in addition. But okay, I see there are a couple of other questions that are coming in. In Perry County.
Oh, sorry, go ahead.
No, Sydney, you might have read them, and I'm just because the one in Perry County, did you get an opportunity to read that?
Yes. So so part of the grant requirement for SHIP is to send out prescription drug plan worksheets to our previous clients. And in some counties, that may complicate things with people who are used to talking with a certain counselor every year, and then they get this worksheet from the state office, and then they send the worksheet in, and then they also have an appointment with someone in their county. I do want to emphasize that that is coming from the top down to your local coordinators, that it is a requirement that we put on the coordinators to do. So my recommendation would be to work with your coordinator, maybe put a little note in the packets next year. If you are working with a current volunteer, please, send or take this worksheet to them when you have an appointment maybe. So that's something to work out with your individual coordinator. Do you have any other comments on that, Vivian?
Okay, because I guess I kind of, I guess I kind of read it differently also, because by the time I got here in November, I think that some of the coordinators were sending some plans or some worksheets in for us to run plans on, or requesting some help because they were running behind as well. So like you stated, we may need to see if we could do better at filtering out when they need to go back. Once we run a plan, do we send them back, or do we go ahead and handle them ourselves? But that's something we can talk about possibly on the next SHIP call.
Definitely.
Yeah, but I will make a note to talk about that on an in-house SHIP call, but we can definitely look at that. Now,
we also had, sorry, did you have more comments?
No, I was trying to see the next one from Mr. Lee.
You want to go ahead and read that one?
Went to Medicare.gov and ran the plan finder on myself, and it gave me the company I had, showed the pharmacy as being okay and the copays, but when I ordered my first prescription, January 4th, the pharmacy was not a preferred pharmacy, and I was told the cost, therefore, for my copays were much higher, so I guess that I have to worry in the future. Thought from October to January, everything would have stayed static for a few months. Sydney, is that one that we could use?
So what I would
and plan finder?
So we always have to remember that Medicare.gov, their prices are estimates, so it's not set in stone necessarily. When it comes to the pharmacies, however, the data that Medicare uploads into the Medicare.gov plan finder is the data that the individual drug plan sends to them to post. So as we look at Medicare.gov, all that information, to our knowledge, is accurate to what the drug plans have submitted. So if anyone else has come into this situation, what I would recommend you do is send Vivian and your regional volunteer coordinator. Anytime you have a question or anything that happens, you should always copy your coordinator so they're in the loop on what's going on as well. But go ahead and send us the name of your drug plan, the pharmacy that you're going to, and we can double check and verify a few things and see if it's becoming a trend across the state. That's the big thing that we want to track, things like that, is to see if there's any trends.
Yeah, and I'm certain that you probably have the printout from what you, and your confirmation and everything from Plan Finder, to let's look at a comparison of what's in there now and what you're paying versus what you were shown when you enrolled during open enrollment. That might help as well.
Excellent. We also had a really great comment come in from one of our coordinators that they are working on updating their mailing list. As we talked about earlier, the coordinators send worksheets out to all their former clients. Quite a few came back due to address changes. We have that as well. But they had an enrollment event in almost each of their counties, and the coordinator who sent this in has the largest area to cover, 16 counties in total, I believe. So having a majority is excellent. And had several volunteers that stood out, and their Part D enrollment outcomes were much higher than last year's open enrollment. So that's great news.
Congratulations. That's awesome. Yeah, I'm trying to get up there very soon also for a visit. Okay. And Nancy says, I recommend everyone read the evidence of coverage from the plan. I guess that's in reference to Mr. Lee's. It should list the participating pharmacies. Okay. Thanks for that, Ms. Parker. Thanks so much.
The only caveat I would say to that comment is the evidence of coverage usually comes after you've already made that first purchase of medicine. So I agree. Don't get me wrong. That the evidence of coverage is definitely something to look at, but it may not come before you find out your pharmacy may not be in network.
Yeah. Okay.
We also, from a couple of volunteers, there was a lot of new clients that came for the first time. So that's great. We're getting not only people who are repeat customers, but also some new people who may be new to Medicare or have new questions. So that's wonderful.
Yeah, we have a lot of baby boomers adding on to Medicare as well. So it's good to know that they've heard or are being steered toward CHIP. Okay.
We did have a question come in. If this happens like Mr. Lee's situation, can the individual cancel their plan? No, they cannot. The person has to stay in their plan and possibly find a different pharmacy that is in network, unless they have extra help or another special enrollment period. Okay, and that's everything from the chat box. Carol Samuels, you have your hand raised.
Ms. Samuels? Okay.
Okay. Nancy, you have your hand raised, and I've unmuted you. All right.
Okay. We've kind of answered some of this, but there may be more for you to share the best part of AEP for 2018. Those super success stories, what you really enjoyed about it.
We had a comment come in that we actually have a new volunteer in a new position who assists older people and really appreciates the SHIP program and everything that we do. So thank you for being involved in the program, and we're excited to have you.
No, we do not, because we're not able to run reports, and STARS is not up as of yet. We do not have the data from open enrollment or annual enrollment as of yet, but as soon as we're able to compile that data, we will get those numbers out. We're hoping within the next 30 to 45 days that we'll be able to get that information. We're going to look really hard in compiling that and getting that to you all as soon as possible. Yeah, it was a very busy time. It definitely was. I'd been gone for 2 years and jumping back in the middle. I'm sure that would be great, since I haven't had any STARS training. that would be something wonderful to do. We can definitely look at doing STARS again, since Sydney probably knows, I don't, but they had STARS training previously, Sydney?
Yes, and Vivi, we may want to say a question came in asking this, so that way everyone knows that we're kind of on the same page on what we're talking about. But when it comes to STARS, the new data system, your coordinators can send you recorded webinars of the data system that was done by the SHIP TA Center. So like myself and the other coordinators haven't really done STARS training since we already have recorded webinars that people can refer to. It may be something that you can work with your regional coordinator on to get some more training on STARS. And Vivian, you may want to consider that for a future update training session, but we do have webinars already recorded and already available to all the volunteers on how to use STARS in the certain forms.
Great. Okay. Thank you. Yes, and I'm going to get better at this webinar thing. I was answering questions and not reading the questions. I am going to let you know. That's what Sydney was correcting me on. So, yeah, and we had comments about AEP was the busiest time ever, and yes, it was, especially for, I think, myself and Tina. It was Tina's first AEP ever, and she was amazed at the amount of volunteers that we had and the time they spent helping others, and it was wonderful for her to be a part of it. And once again, for me, coming back after being gone for about 2 years, I was able to jump in and help with running plans and help during AEP, so I felt right back at home. So that was wonderful as well. Okay. So are there any other great things about AEP? Okay.
This is Sydney. My personal story that I thought was wonderful, and many of you attended this event, but we had our first ever statewide volunteer conference for SHIP and SMP, and we had over 100 volunteers attend. Granted, that was a little bit before AEP, but I want to thank everyone who's currently on the call who was able to attend that first annual conference. Hope we'll be able to do it again this year and have even more people come.
Yes, it was great. It was wonderful, and I enjoyed attending. And we had a comment from Lori. It was the best ever for AEP, and they averaged 30 to 50 calls per day for the greater Nashville area. And I'm sure they did, because we got a lot of calls here as well when it came to AEP. Okay. Now, are there any additional questions? Any comments? Concerns? Okay. The webinar will be available on the YouTube channel, hopefully no later than this afternoon. And we're going to ask that you please complete the survey. The information on how to access the survey is on the link below. And I will send a follow-up email today. And once again, the webinar will be for you to access on the YouTube channel later this afternoon, where you will be able, I know someone asked about being able to print it out. So you should be able to go back to the email I sent today, and I believe as well as on Tuesday, I sent an email with the attachment. And one thing, I also sent a cost tip sheet that I did not go over but the cost tip sheet was attached as well today. The next webinar will be on and I need to correct that date. The next webinar is going to be on the 21st of February. and I'll make sure that I get that corrected to you, a corrected slide to you for February 21st. It is going to be on durable medical equipment, on fraud and how to prevent it, and it will be done by Lonnie, the SMP coordinator. But it will be on February 21st. And so make sure you go ahead and register for that one. And I will get the information sent out no later than next week for registration for February 21st. And once again, that was my oversight in correcting that date. And we're going to go ahead and end recording now. I thank you for attending. You guys have been great.